Yeah.
Yeah, long time. Back on track.
Yeah, I'm
Back,
going.
back on screen on
Line.
Vision India Forum. Dr. Alexander Thomas. The proud moment when you were awarded by the royal family of United Arab Emirates. I would like you to start with that note on the Vision India Forum series today on perils of practice. India has been rigged with violence against doctors, and obviously the entire issue is not completely uncalled or unfounded for. Dr. Thomas, you are going to be speaking on the book that you wrote on the subject, and take us through the both sides of the coin. Because every effect has a cause, and perils of practice. Uh, I would like you to delve more into the causes as well and future going forward, ensuring that these kind of issues become streamlined in such a way that people who are practicing the noblest profession do not feel, kind of, what you call threatened by any means when they have to exercise medical judgment. It is almost similar to the bureaucracy shouting from the top of their voices, calling for some kind of autonomy in terms of action, and false vindications should be avoided. Otherwise, the decision making, what you call entire decision making process of the bureaucracy gets affected. Similarly, doctors are in the same field. They also deal with human lives. They deal with human lives more complicatedly and intricately. I mean, it's not a social economic issue, it's life that the doctors deal with. And henceforth, their engagement with the second party or the third party becomes much more complicated, crucial, and something which has to be streamlined in such a way that going forward in a country like us, which has a huge dearth of infrastructure from the medical perspective, doesn't land up blaming the doctors for all the perils, all the issues, notwithstanding malafide or medical negligence, which is again something which is not completely new to our nation, which is because we are a developing economy. But going forward, I hand it over to you. The perils of practice, starting with what made you land up with that coveted global award, which makes the country so proud. Dr. Thomas, over to you.
Thank you, Amit. I think let me start with the global waterfalls code. I think it's very appropriate. During COVID, our country's efforts were recognized globally for what we did. Um, for a short time, the government and society made sure that doctors were well looked after because we were needed. So, in a nutshell, AHPI, the organization that I work, contribute most of our time, we did a phenomenal amount of work through our state presidents, 20 state presidents. We helped in spreading awareness. We helped in getting equipment for doctors. We helped in educating them. And as a result, we were awarded one among 15 in the whole world, awarded by the UAE government for work in the COVID situation. So, with that, let me just start about the status today. As in our culture, if you look back, just a few decades, when I started practice 3, 4 decades ago, the medical profession was seen as a noble one, which you very aptly described. And doctors were viewed as healers and guides. Unfortunately, since then, especially over the last 10 to 15 years, I think the situation has changed dramatically, and unfortunately for the worse. You look at the situation today, there are violence in every state, in every district against hospitals and doctors. The Actually, the impetus for writing the book that I wrote, The Perils on Practice, which is here on the screen for you, this actually came from, we had a very unfortunate incident in Rajasthan where a young gynecologist who was providing service to that particular area where there were no other gynecologists. She was treating complicated cases. And she got a call from 2 districts away from one of our patients saying that this is my fourth child, it's a boy. The people here are not able to handle it, so we want to come there. So they went there. Unfortunately, because of the complications of childbirth, this particular complication called postpartum hemorrhage, it's a 35% incidence of mortality. This poor couple Archana and her husband stayed up the whole night, gave blood, did all they could, but unfortunately the patient died. And then initially the body was interference, some gundas were involved. Ultimately, this young lady was so harassed that she committed suicide. And all of you will also remember the recent one in incident in Kerala, where a doctor who was treating a patient who was a convict stabbed her to death, and that also created shockwaves. But it just highlights the environment that healers in the country, in our country, live in. And when I say medical professionals, I'm talking about nurses also. It's not something which is special to our country. The World Health Organization has defined violence against healthcare personnel as an international emergency that undermines the very foundation of health systems. And that's very, very relevant to our country as we are trying to improve our medical care. So I think we need to keep that in mind. And if you look at today, no physician, however famous, however conscientious, however careful, uh, we cannot tell when we will be attacked, when we will be the object of some undeserved attack, malicious accusation, blackmail, or a legal notice for damages. So any young doctor or any young nurse who comes with a certain amount of trepidation, and this is going to affect the health quality of healthcare because the brightest minds which were earlier coming into medicine, people will think twice about it. So let's look at the Indian scenario about, because in this book we got eminent authors. Since this is a publication of repute, we had to actually do a lot of validation of data. And according to the IMA, 75% of all doctors have faced violence at work, verbal abuse or gestures, or and 12% cases of violence lead to physical attacks on doctors. So that's very, very high incidence. And 70% of the violence has been caused by the relatives of the patients. There is a small percentage of antisocial elements who try and leverage the situation. Now, there's one area which we really haven't looked into. It is there every day, it's happening. Nurses are quite often bear the brunt on a daily basis because they spend most of the time with the patient and patient relatives, and this is unreported. And we have identified that the areas where the violence occurs is in emergency care, in the intensive care units, and in the obstetrics and gynecology. These are the three most common areas. Now, if you compare India to the world in terms of violence against healthcare workers, we have an incident of 3 incidents per 10,000 uh, healthcare workers. This is based on the 2019 statistics. This is 5 times more than the global rate. Among the South Asian countries, we have the second highest. The highest is Afghanistan, and Afghanistan is a conflict zone, so we really can't consider that. The incidence of violence in India was 57 times more than in the UK, 850 times more in China. And both these countries, China and UK, have taken legal action against violence. So it's nobody, people will think twice before attacking a hospital or healthcare worker. Nepal, which is a neighboring country, has a much lower rate. It's just less than 1 per 10,000 workers. But recently, even Nepal passed an ordinance for protection of healthcare workers. Now, what are the reasons? I think this book was basically to come out with the reasons, introspect, and see how we can at least minimize it. We may not altogether avoid it, but how to minimize it. Poor communication skill of healthcare workers, lack of emergency resources, and this is especially true of public hospitals. Emergency, if you go to any emergency department in the hospital, government or private, you see that the patient's waiting. So these departments are really overwhelmed. And in India, there's a very high workload. I often refer to my time in Australia. When I had an outpatient, I was only given 10 patients. I didn't have to go for rounds, I didn't have to operate. In India, you have to do rounds, you have to do your surgeries, you have to do administration, and then you see 30 or 40 patients more. But fortunately, that is being addressed because the number of seats have been increased. Now, some of the other causes are intolerance among the youth population, fearlessness against law. This is actually concerning. People are not worried about the law, and restlessness among the youth. And there is a mistaken belief. I think it's carried out from the British era that hospitals should give its services free or almost free. And the other issue which we have spoken about in the book is unrestricted access to all areas in the hospitals with overcrowding. This is changing, but that is one of the reasons. And lack of security, surveillance, and drills in the hospital, and of course, lack of civic responsibility among the public. One of the big reasons for this violence continuing is absence of legislation and a strong law against violence towards healthcare workers. I think there is a need of the hour. I'll talk a little bit more about it later. And unfortunately, now over the last few years, there's a negative image of doctors portrayed in the media. The negative stories come up. There's probably 1% of doctors who drive around in the latest cars, have a palatial mansion, but people think all doctors have this and that their money is just flowing through different practices of the doctors. Political interference when there's an issue in the hospital. And I think one of the big reasons is that the doctor profession coming under the National Consumer Redressal Forum. Inadequate commission is a major, and that is our fault from the doctor side. How do we communicate with the patients? From our side, unethical practices and lack of self-regulation. I think these are things that we need to correct from the healthcare worker side if you're going to make any progress. Inadequate communication, unethical practices, and lack of regulation. IMA and HPI, two of the largest bodies, have repeatedly told in public forums, unethical practices, let the law take its course. Actually, if you look at the situation in India today, there are many grievance redressal mechanisms. You look at the civil code, the criminal code, the human rights, the child rights, but there is the awareness of these grievance redressal forums are not very much in the available in the public. And most of the people don't know about it. And also, there's very inadequate knowledge about the legal and regulatory mechanisms among the healthcare professionals. Most of the doctors focus on their practice and know very little about legal. I remember the first legal notice I got from a lawyer. We were treating a patient. It was a team effort, and there were some issues with the plastic surgeon. I got a legal notice. That was soon after I finished and came back from Vella. And just a legal sleep for almost 3 4 days because I didn't know the law. So it's important that doctors are empowered, nurses are empowered. Now coming to the possible solutions, I think it's important that this in the National Consumer Disputes Redressal Committee, we need to look at it again. If it is thought that it should continue, let it continue. But I think we need to have a cap on compensation because what is happening? Just last week in Bangalore, a hospital was fined 1.3 crores for an act of which they felt was medical negligence. Fine, I think it's all right. But I think you need to cap it. See, a murderer who is jailed doesn't have to pay any money. He's in jail. But here you're talking about a doctor and saying that you have to pay, or a hospital, small nursing home. What will happen if this is continues? Smaller hospitals will not start, and if they start and something like this happens, they'll close down. We need fast track courts to handle violence against healthcare personnel. I think one of the authors in this book is a very well known Director General of Police, retired. He says that there's only a 2% conviction rate because it keeps the cake, the opposite party keeps postponing it. So he said if you introduce a fast track court within 6 months, conviction rate will also increase. The hospital and doctors, lawyers will also be part of it to ensure this doesn't happen again. And believe me, if there's one action, I remember when I was director of a hospital, and violence was almost an everyday occurrence. So one day there was a political party fellow who didn't want to pay the bill, so he created a big galata in the hospital. So I said, enough is enough. We filed a case against him, followed it up. He came back begging to me, but it was like a tap had turned off. There was no violence after that. So people need to be aware that you're going to be strict about it. Very importantly, I think there needs to be a central act for prevention of violence against healthcare workers and assaults to be made non-available in all states. At the present time, there are only 25 states which have made this. Now, this is where I'll come back to COVID. I think during COVID, we've lost 3,000 of our colleagues during COVID. And our medical colleagues, nurses, doctors, healthcare workers did a phenomenal job. And I think they are the reason that India succeeded. So during that time, there were a few stray violence against doctors and nurses and healthcare workers. The government immediately came in and enforced the Epidemic Diseases Act, uh, which actually recognized any violence against any healthcare worker non-bailable offense. So after this COVID was over, we went back to the government and said, why don't you uh, continue it? Unfortunately, that was not done. So I think this is something that needs to be done urgently and immediately. It may not cut down everything, but it has to be a holistic approach. Now, internal self-regulation is very important, and I think in the hospital setting, we have to self-regulate ourselves. We have to do regular programs on audits on clinical outcomes, audits on practices. We have to do financial audits to make sure that the patient gets. See, at the end of the day, all of us are working only for one person, and that is a patient. And I think it's important that all of us remember that the patient is central to us. We have to ensure that quality of care is good, that the cost of care is kept to a minimum. Make profits, but there has to be some cap to it. There is no question about whether we need to practice ethical practices. And again, at the cost of repetition, those who are not doing unethical practices need to be hauled up and the law needs to take its course. Hospitals and healthcare providers need to be absolutely transparent. NABH, when I'm part of, necessitates that the rates of all the procedures are kept out so that the patient will know what he's getting into. And we also suggested that in every individual hospital, there should be a grievous redressal committee. So if any patient has any problem, it could be dealt with immediately. And the hospital administration needs to keep a ear to the ground to anticipate any violence and prevent it. Now, some of the other solutions, I think, as I said, in my impression, lack of communication skills is probably the most common cause for these issues. Sometimes we are not sensitive to the patient. They are so emotionally fragile and battered, and we need to communicate especially with them. Unfortunately, in the medical curriculum and the postgraduate curriculum, this is not taught to us. This is very surprising because in UK and in USA, unless you pass an exam in communication, you don't get your degree. Hey, the good thing is we actually 2000, I think it's 2012, we recognized this and I edited a book on communication called Communicate, Care, Cure. Became a bestseller. And I think most importantly, we were able to convince the Medical Council of India to introduce this into the curriculum. It was introduced in the undergraduate and postgraduate curriculum. And this was in 2019. So I think from 2025, you will get a batch of people, doctors who know how to communicate, and you will actually see the effects on the ground. What we did is to cover the gap. We started workshops on communication. We probably trained 200, 300,000 doctors, nurses, and paramedical people. And I think millions of patients have benefited from this book. So I always say this little book, it's just 200 pages. It's created history and it's added a lot of value to the patient. Now, communication skills, we are continuing to capacity build. We've actually just recently started a course with the Health Sector Skill Council. The government has recognized that this is a very important skill, so this is going to be made an online program affordable to any healthcare worker. Also, just for information, since I'm associated with the NABH, in 2014 we introduced communication skill as one of the standards for NABH accreditation. Now, communication externally also is important. The hospital needs to communicate with the local community, with the people's representatives like the MLA or the corporator. We need to communicate with the medical authority, the medical associations also. Like IMA has a system where if there is trouble in one particular nursing home, a lot of doctors and other workers reach that hospital to provide some sort of a boost to the local hospital. We need to, very importantly, liaise with the police. I think I always, when I give my talks on communication, I said, please call the SHO over, have a cup of tea with him, call him for your functions. We need to also liaise with the judiciary, and most importantly, equally important is the media. Networking with the media is another skill which is very, very important. Uh, if you look at the last few years, it's all negative stories, negative stories. How a doctor did this, how he cheated this. I think they need to start reporting positive stories. Believe me when I tell you that at least 80 to 90% of our doctors have good intentions. We have trained, we know that we have trained to enter a noble profession, but like in every other profession, there will be black sheep. So I think the society needs to take note of it and try and change the image and report positive stories, help in building positive public perception. And there also has to be a supervision of media by regulatory authorities, because unfortunately now any media house can pick up anything and portray it from their perspective, and that just adds to the woes of the healthcare providers. These trials by media, there have been so many, and they need to be discouraged, and they also need to be penalized. On the ground, I think for each hospital, we have come out with some guidelines. We have suggested that every hospital has a helpline so that the patient or the attender can talk to the other person and ensure that the helpline ensures that his grievance is taken care of. We also have recommended CCTVs around to pick up signs of violence. And as I mentioned earlier, most of hospitals don't have any limit on visitors. We have said that restrict the number of visitors, especially during after hours. Signages should be put out. When I was in hospital, we had a sign out saying that attacking a hospital or healthcare worker is a non-bailable offense in these four areas that I mentioned: the emergency, the intensive care unit, etc. And there has to be a good communication system in the hospital. Initially, when I was in Baptist, when there was a problem, nobody else in the hospital knew about it, and the employees were targeted in that particular department. So now we have a system where once the problem happens, everybody comes together. And on the ground, we have come up with some guidelines. I won't spend too much time talking about it, but this book is available free online. There are details on this. And this is basically for smaller hospital owners, this particular chapter, how you can prevent and also keep an eye out for unsavory incidents, and also ensure that the victim, the healthcare worker who's being targeted, that we take care of him, that we counsel him, and then post the incident, that we make sure that he's supported. So it was as a result of all this that IMA and the APA decided to write this book. We've got some very eminent authors. In fact, the Chief Justice, former Chief Justice of India, Dr. Venkachalaya, he is, I think, 94, very eminent. He wrote the foreword. Now, the way forward, we are looking at engaging with all healthcare stakeholders at the state and national level, and we're in the process now, getting all suggestions, and then we will take it forward. I think what is the downside? I think the society needs to be reminded of this again and again. There is a psychological trauma to the healthcare worker that will hinder the performance. It's actually will cause a lot of loss of morale to the entire professional. Hospitals may shut down, leading to non-availability of healthcare to the common man. Defensive practice increases. Now, see, today, earlier, if somebody had come to me with a headache, I just prescribe, after examining, of course, would prescribe some paracetamol. But today, if somebody goes to a doctor with a headache, the first thing he writes is a CT scan, because if he doesn't do it, he's open to being a case being filed against him. As I mentioned earlier, this will discourage students, bright students, from taking up the medical profession. And I can tell you from experience that ultimately it's going to affect the community, because in many places after violence, hospitals have shut down and people have to travel 100, 200 kilometers to get treatment. So I think you look at it logically, the ultimate loss is to the community. And I think we should remember that. And as a noble profession, we would like to serve as much as the people as possible. So, in a nutshell, violence against healthcare workers is an urgent problem and requires attention from all societal stakeholders. It cannot be something that we as a medical profession can sort out. We have a part to play. We will do that. It is not just a medical fraternity issue. It weakens the health system and affects the quality of service being provided to patients. And I think that's an important point to note, that the quality of service goes down. It leads to more chances of violence because quality is down. So I think the key to breaking away from this vicious cycle is pushing for immediate zero tolerance policies. And it is our wish also, I'm talking as a member of the medical fraternity, that we need to strive to bring back the sacred relationship between the patient and the healthcare worker. And India was led in this relationship, and we hope that we will be able to get back there. Thank you, Amit.
Dr. Thomas, thank you so much. I was initially, when I started the conversation, I hinted upon uh, what we needed from you is also to speak a little about the causes and then what can be done to nip the causes in the bud. Because you see, a patient doesn't go to a doctor to basically intimidate him or to engage in violence with the doctor or with the hospital. They are dealing with their problems, their lives. They are willing to pay. Now, the medical and insurance companies, they take the patients for a ride, and henceforth, not without. There is no, smoke without fire. Please understand. It's basically a case of reaction. It's not a case of some kind of a choice. It's by design, because it is the case of human life. It's not about merely some property issue. It's human life. And empathy, sensitivity, communication, all that is fine. But then what recourse do the patients have if they cannot went out, because they are in the completely in the dark? It's almost like, even if the plumber comes to your house, you don't know, when he puts up a bill to you, he says this is wrong, that is wrong, and then he starts billing you something, something new has to be replaced. So you are not at all aware of what exactly is the problem. In the case of a medical issue, the problem is the most complicated. It's a scientific issue. None of us, none of the common men are aware. So whatever the doctor says is God. God says you need to do this, we do it. And ultimately, if God cheats you, and that is what the trust factor has been completely diluted over years. It's not only about the quality of treatment, it's about not only about communication, the entire trust factor has been shaken up. And it's not because of one, rotten mango in the basket. Probably the basket is rotten now. Some good mangoes are there, because of which we still, are able to fight out. And it's not only about hospitals. It's about individual practitioners also. Hospitals are organized. A man sitting in a hospital has a lot of stakes, as a doctor there practicing there. He's got a lovely cabin. But individual practitioners, how do you control them? They are free to do whatever they want. And the patients have no business, venting out their ire at the doctor or the medical fraternity, unless and until they're on the wrong side of the ladder, of the rope. So what recourse do patients have? I don't see I have any recourse, because if I write to MCI, I write to IMA, I write to the health ministry, I write to the state medical council, they are a bunch of rascals, let me tell you. It's my personal experience. Now, where do we go after that?
Yeah, so I think, Amit, when I'm talking about communication, I'm talking about communication with honesty, transparency, and empathy. And that is the key. We are not God, we are ordinary people, we make mistakes. But patient comes to us, as I said, he comes to us very vulnerable, he comes to us with the problems, and it is our business to first make him comfortable. There's no question of cheating him. It unfortunately it happens. So we need to make him, and that's what we teach in communication. We need
Is
to.
there any ombudsman? Is there any commission? Is there any ombudsman which is really going to act on at least 25% of the complaints? It's a complete, everyone is in dark with respect to, such consumer forum. How many people have the capacity to run after consumer courts and run after consumer disputes and, start finding cases against, I mean, uh, in this country, the judicial system is in a mess. And especially if it crosses the criminal kind of barrier, or if it lands into the criminal territory, then we all know, as you rightly pointed out in one of your sentences, the cases can keep getting postponed, dates keep getting extended, and we all know the condition of the judicial system. And finally, a patient has nothing. It's got to gain nothing. Nobody's. Very few people go to a hospital to get a compensation. They go there to just come back healthy and alive, which unfortunately is not happening. And it is something which has the most, what do you call, sympathetic or empathetic or what do you call, emotional kind of blow to the patients as relatives. And henceforth, this ire is vented out. So, is there any really operational forum which maintains the secrecy of the whistleblower at the same, because we have, if we don't institutionalize this, implement this, and see the effect or see the effectiveness of that institution, I mean, this imbroglio, this the doctor patient conflict will keep growing in this country.
Yeah, so I think we need to actually look at it holistically. I agree with you that it can't be just from one side. That's why I think in this book we have tried to put everything together. We have given recommendations. So I think the first thing we need to remember is it's not always only patients and relatives because of bad communication. Unfortunately, the antisocial elements are not playing a major role. They come in, they promise the relatives that they will get a discount and they create. So we have to keep that in mind. And all I said about fast track courts, etc., is directed to them. But I think 70 to 80% is actually patients very preventable. And I think that's why we have said that every hospital should have a grievance redressal mechanism. All the states have now something called the Clinical Establishment Act, where the patient can go directly to the state government. They have a grievance mechanism. I don't know how effective it is, but the focus of this book is to try and sort out all the issues so that it doesn't reach that stage. Communication is
Sir,
important.
just you've been focusing so much on communication. Let me just cite it because we need to close the next 2 3 minutes. Then one small example: pediatricians deal with kids, infants, kids. Now, best of hospitals which have the all the resources and facilities at they have that at their disposal. They can't they at least have a system of not making such small infants with 3 degrees of fever wait, because a number has to be taken, and if you are 50th in the line, you need to come and sit there for 5 hours, 6 hours, and the doctor in the meantime has to go for rounds also. And finally 11 o'clock they reach, and then 5 o'clock the small kid with a 3-degree fever is waiting because he will not be informed about his number coming probably in the next half an hour or 1 hour, so that the family, the patients can plan arrival at the hospital just an hour or so before the doctor has to see. There is no professionalism, no sensitivity about it. Even in the bestest of hospitals, I can name also them. I mean, even the bestest of hospitals, the biggest of brands. I mean, there is no space to walk. I mean, if and I might go, on record to say a brand like Narayana, I would not never name such institutions, but just for an example, I'm not getting into controversies. But my experience dealing with the heart hospital in Narayana, in one of the states, in one of the places, it was so crowded. I felt asphyxiated. I could not breathe there. It was so clumsy, crowded. I mean, such big brands. I mean, just because we are short of the infrastructure, at the end of the day, uh, healthcare and communication is inextricably linked, and the patient's safety and sensitivity is of paramount importance. And finally, the moment there is any kind of catalyst or any kind of trigger, it blows up, and it blows up beyond proportions. So I mean, such small sensitive issues like making patients and kids wait for hours by these specialist doctors, in such big hospitals, at least that those things can be taken care of, so that slowly the confidence of the people starts building up. No, things are getting better, things are getting right. We see no such good improvements happening anywhere.
So I think I'd probably disagree with you there, Amit. I think with technology, see, one thing is when a child is sick, they don't come and wait in the OPD. They go to the accident and emergency. And in India, they are seen fairly quickly. In UK and US, they probably have to wait for 3 4 hours. But in India, they're seen almost immediately. And again, you're talking about crowding. Now, what is the reason? There are limited doctors, limited specialists. Now, if it's violence, it's a vicious circle. If violence continues, less people will come here, crowding will go. So I think it is a problem which has many dimensions, and it has to be a collective and holistic solution. I think it just drives home the point that it has to be a holistic solution by all
Any
members of society.
institution which can be a recourse to the patient, because AHPI is there, IMA is there, medical council is there. You want a big banner outside hospitals saying it's a non-bailable offense, but any institution which maintains the secrecy and acts as an ombudsman like the Vigilance Commission or IRD or whatever. I mean, all these institutionals are being set up. I mean, in India it's not that easy, but medical fraternity doesn't still has it still got anything wherein the patients can be confident about citing a complaint and being not only about getting a solution or grievance being redressed, but also their secrecy being maintained. Because in India, the moment you blow a whistle or you complain about anybody, the maximum chance is that there shall be counter allegations against you, and then and the powerful, or the man who is more powerful, will be on the right side of the law.
I agree with you, but see that is the reason I'm saying no. So if you go in that direction, it's only allegations, counter allegations. The doctor spends more time in court. The patient spends more time in court. So the objective of this book and this movement is prevention. So we're trying to see that bring in measures which will prevent this happening.
Okay, thank you, Dr. Thomas, because this can go on. I got your point. There are still no answers. We need to follow it up with the health ministry and probably the Prime Minister's office to ensure that the patients also have a institutionalized mechanism where their grievances can be redressed and their secrecy of the whistleblower can be maintained, because that part of the story is totally unaddressed, because patients are individuals. They don't still have a forum, consumer forum or otherwise. Doesn't really serve the purpose of the patients, because patients go to hospitals not for goods, they go for life. Thank you so much, Dr. Thomas.
I
I look
agree
forward
with you,
to.
and let me end with this: that for all of us in the health industry, we are there because of the patient. The patient is central to us, and once that I think is ingrained in all of us, these problems should get better.
It's an
Thank you.
individual choice. It's an individual choice, but then we are in 2023 and 140 crores plus going. Thank you so much.
Thank you.